Thank you very much. Thank you for the introduction, and thank you to the organising committee for inviting me here to this conference. Thank you also to all of you who have attended. It's been very nice to get to meet you and chat to you as well. So yeah, my focus is on understanding stress fractures, and today I'm going to give you an overview of what we know about bone loading in real time and during running in particular. So a bit of background to the problem of bone stress injuries and how we go about and have gone about in the past to identify risk factors for these injuries. And then we'll look at some of the biomechanical approaches to estimating bone loading internally, the extent to which we need to make that specific to each different participant. And then I'll touch briefly on these final points regarding how we can do this, how we can measure these things in real time and in the real world rather than in the lab, and what we need to do to validate these findings. So a bit of background. Running overuse injuries are known to be a problem. The reports, the prevalence are wide-ranging. 19 to 79% doesn't really tell us much because it's such a wide range. But what we know is that if you take a group of people and they're all going to go on some running regime, then there's likely to be injuries. And my interest is in these bone stress injuries, not because they're the highest prevalence in comparison to knee injuries and others, for example, but because they result in so many months of time loss, many weeks required to rehabilitate from these injuries and the risk of recurrence. And not only that, from a biomechanical perspective, I feel like these are an injury that we can do more to improve our understanding of. Acute injuries are something that are arguably more inevitable, whereas when you take large populations, for example, with the military, and they undergo very similar training and some of them get stress fractures and others don't, then I really feel there are some mechanisms that we can do better to understand. So when we talk about bone stress injuries, these are on a continuum. So this is one of the reasons they're challenging to understand, is because they're not necessarily very easy to diagnose. You have at the most extreme end of the spectrum a stress fracture, but you can have bone pain and problems lower down the spectrum as a result of bony remodeling. And so this whole spectrum of bone-related injuries we refer to as bone stress injuries. But it's stress fractures that are the most common, and these bone stress injuries are reported to comprise around 30% of running-related injuries. Now my focus and what we're going to have a look at today is on the tibia on the left-hand side and the second and third metatarsals as well. So tibia being the most common site of these stress injuries, and then the